Well, there's a reason for the expression pain in the neck. Not Mary, because a pain in the neck is really uncomfortable.
Yes,
That's why.
Our next guest knows that all too well, but she's found relief through NUCCA care at the Spinal Balance Health Center here in Omaha.
Yes, she sure did. Welcome, Marcia Fiocca, alongside the professional that helped her, Dr. Drew Drummond. Good to see both of you this morning.
Nice to meet you, Marcia. Welcome back, Dr. Drummond.
Thank you.
Marcia, let's start with you. You had some pain in the neck, right? What was going on with you?
Pain in the neck, pain in the back. It started many years ago. I, as a young woman, was told that I had a slight scoliosis, and so I just kind of chalked it up to that it would be, over the years, a little bit painful. But as I did get older, my neck especially started to be uncomfortable, stiffness, movement, and last winter, my husband and I got rear-ended.
Oh, heavens.
Make things worse.
Yes, yes, it was
How
much
was it
worse.
affecting the day-to-day for you? And maybe even over the years, you might not have even noticed the impact after a while.
Well, that's true, and especially my lower back. I'm managing the American Hotel over by West Roads Mall, and I'm on my feet all day long, and that really has an effect on my lower back. And you know, the only relief I get, you know, is just to mask the symptom of the pain.
Dr. Drummond, you've seen that a lot.
Yeah. Did you give up on treatment options after a while? Because you had battled this for so long. Yeah, I imagine you tried a lot of different things throughout the years.
I did. You know, I never went to a doctor for the problem. I just kind of self-medicated.
Yeah.
But you can only take that for so long,
Right.
too, before that has other effects. So.
And it wasn't working. You still had the pain, the discomfort.
Exactly.
Dr. Drummond, I'd love to, for our viewers who aren't familiar with NUCCA care, would you explain what it is and why it is that it can have such an impact on somebody like Marcia?
NUCCA is an acronym that stands for the National Upper Cervical Chiropractic Association. But what it is if not the most specific chiropractic technique, it's one of them. And what it does, it revolves around adjusting the very top bone of the neck. Because when that bone becomes misaligned, it starts interfering with the nerves that control the body's posture. So with this one misalignment, it throws the entire body's symmetry off, and you can see how the nervous system works by this little clip. Nerves pass, impulses pass from the brain out to the body, and then from the body back to the brain, and it's this dynamic cascade of information exchange that allows us to do things like stand straight up and down.
And this isn't new.
No, it's not new at all.
Rich history for
it. It has been around. In Omaha, it's only been around about 8 years since we opened Spinal Balance Health Center, but it's been around since the 40s. In fact, one of the powerhouses in our profession, Dr. Dick Holt Sr., just retired, and he was 91.
So he'd been around the block a while.
Practicing.
Yeah, but it's just not for patients that have pain in their upper neck.
No.
There's a variety of different symptoms that could lead a patient to use.
Yeah, we talk a lot about neck and back pain when we bring patients on here, because those are two of the areas that tend to compensate for an overall body imbalance. But once that happens, it will affect the nervous system in a way that could cause headaches and digestive issues and a number of issues. In fact, last week we had a woman whose hearing, she was more than 50% hearing loss in her right ear, and it completely came back after one adjustment. And that's the effect.
It was a nerve issue?
Yeah, it was a nerve issue. Yeah,
wow.
Exactly.
And I see you nodding as soon as he started talking. What kind of difference have you seen?
Well, right from the very first adjustment, I mean, the stiffness, the pain in my neck went away that very first day. You know, and it's a process, it's a slow process to go through, adjustments over a slow period of time, but, a little bit creeps back, and then we go back for, another adjustment, but it truly is amazing how other things are affected. When you don't realize, just by having the adjustment in your neck, what difference it has made that you didn't realize.
A lot of people think they're just getting old.
Yeah,
we hear that so
that's
often.
what I
It's
thought.
not getting old.
It's part of the aging process.
So what other symptoms were you having that you didn't realize that you were having?
Well, not only symptoms, but just like, I was crooked. My body was crooked. Bra strap would fall all the time, one side.
Isn't
that interesting?
Panties would creep up on one side.
I love your candor.
Shoes, you wear one side of your shoe heel.
Right.
It's all related to that. It's amazing.
Yeah.
But I think a lot of women,
I
the
would not have
guys are
thought about
laughing,
that.
but a lot of
I know,
women are
right?
going to relate to what you're saying. Have you recommended Dr. Drummond and NUCCA care then?
Absolutely, and my husband's coming back to town shortly, hopefully. And
I look
I'm
forward
bringing
to
him in. We're just so excited.
How should people out there know if they're a good candidate for this NUCCA care?
Yeah, a quick and dirty way at home is just looking at your posture and seeing if you can notice an obvious shoulder that's higher than the other, or head tilt, or maybe you've been told you have one leg longer than the other. These are things that will manifest from an upper cervical problem. But some of the more subtle ones, you need to have somebody like me take a look, because sometimes you look and the differences are 1/8 of an inch from shoulder to shoulder, or a 1/16 to 1/8 of an inch from leg to leg. So you got to have somebody look.
And you're looking at the spine as well when you.
Yeah, we look from head to toe. There's some real subtle changes to the posture that make it very obvious that it's an upper cervical problem. And then ultimately X-rays. You've got to measure it.
An offer for our viewers to figure out if in fact you're a candidate. Can Dr. Drummond make the kind of difference for you that he's been able to make for Marcia? The first 30 people who call his office receive a consultation, an exam, X-rays, that whole bundle for just $50, sort of the toe in the water to see, is this right? What is this about? You can learn more online at spinalbalancehc.com. But if you want to take advantage of that offer, please call 452-3400. And we've welcomed Dr. Drummond several times to the show, and you can even go to our website and search some of those past clips to hear other patients and their stories. I think that'd be a smart way to go. Marcia, congratulations.
And the bra strap's not falling off the shoulder anymore.
No, isn't that great?
And these are nice where they're supposed to be. Life's good.
She's so frank about it. Yeah, Doctor,
You're
thanks for
fun.
coming in this
Thank
morning.
you.
Thank you.
Guests of the
See you.
morning